Author of that section of the bill, H.R. 3200, Section 1233, Congressman Earl Blumenauer with us tonight on The Ed Show. Congressman, let me ask you straight up, are the Republicans lying about this alleged death panel? I mean, they're saying that there's a death panel. You put it in there. You're the one. Are they lying?
They are lying.
Thank you. That's what I wanted to hear, because that's exactly what they're doing. Congressman, what is this provision that is causing this firestorm and striking fear in the hearts and minds of seniors across America?
It is a bipartisan effort to make sure that senior citizens and their family have an opportunity to get consultation with the medical professional of their choice, to know what they're getting into, to know what their options are, how to make sure the family wishes are respected. This came from bipartisan legislation that I introduced, that no Republican spoke against, and in fact has Republican co-sponsors, and has had Republicans tell me and speak publicly about the need to make sure that seniors' wishes are respected and they get the tools and information they need.
Why? I mean, the polls are showing that this fear tactic is working. The president and his efforts to reform health care starting to slip with seniors. So how do you turn this around?
Well, that's exactly what you're doing here, Ed, is putting the spotlight on a blatant, obvious lie.
But you've got Senator Grassley out there basically endorsing this rhetoric. In fact, he mentioned your House bill on the stump, telling people that they should fear you, Congressman.
Well, and what's happening is that every independent observer who has fact-checked this gives this a for Pinocchio, pants-on-fire liar rating. Every major newspaper that's editorialized, people are seeing that this is a categorical untruth, that they are trying to spread falsehoods.
All right.
And I think, Ed, what's happening is that you're getting unprecedented attention, and something that is this blatant is not only exposing the lie about this provision, but it's showing the lengths to which they will go to prevent health care reform.
Congressman, that is it. And I just find it, as a news consumer, hard to believe that someone of Chuck Grassley's stature in the Senate, who is the ranking Republican on the Senate Finance Committee, after all these years in the Senate, would just be making a mistake on a House bill, which he probably hasn't even read yet. And also stoking the fire on this, of course, is Sarah Palin. I want your response to this. Her latest posting on her Facebook: President Obama can try to gloss over the effects of government-authorized end-of-life consultations, but the views of one of his top health care advisors are clear enough. It's all just more evidence that the Democratic legislative proposals will lead to health care rationing, and more evidence that the top-down plans of government bureaucrats will never result in real health care reform. Well, I'd like to point out that there's rationing going on right now by the insurance industry. Dispel that myth right there about rationing, Congressman.
Well, the point is, we are making choices now. Millions of Americans have health care rationed because they can't get access to it, or it's only through an emergency room. The point is, there's nothing in this legislation that speaks to rationing. It's the opposite. It gives access to people. It removes the fear of bankruptcy that is stopping a number of people from taking advantage of health care opportunities. And it's part of what they're trying to do to change the subject. Making up things, keep layering argument after argument that's bogus, and hopefully they think something will stick. Well, I think it's catching up with them.
And finally, Congressman Blumenauer, we've seen some pretty contentious town hall meetings, and you guys are going to end up going back to Washington working on this. And I'm just curious, are you so hot under the collar about this after being so maligned by the conservatives? If you bumped into Charles Grassley in the hallway of the Congress, would you tell him to his face that you're not telling the truth to the American people?
Absolutely. I find this deeply offensive, and frankly, there are a number of friends of mine that I plan on following up with to try and understand what's in your head. This is stuff that you supported last month. Why aren't you speaking out in support of it now?
Congressman, great to have you on the program. Keep up the fight. You're welcome here anytime. I appreciate your honesty tonight. Thanks so much.
I appreciate your work.
Thank you kindly, sir. As to this issue, Mr. Obama has spoken before of not making the mistakes the Clintons made. But here today we saw Chuck Grassley bury a provision. He based it on a lie pushed by Sarah Palin, but written originally by Betsy McCoy, the same big pharma shill who's now discredited lies, got the first reform killed while the Clintons were in power. How is Mr. Obama doing any better at this point?
Well, first of all, I don't think Chuck Grassley has the power to bury anything. The way the Republicans are behaving, they're digging themselves deeper and deeper into a hole. They are playing to their base, and their base is all excited. The trouble is their base is shrinking, and nobody really cares if you're under 35 and you voted 63% for Barack Obama about what the Republicans have to say, because they're becoming increasingly irrelevant. So I don't, Chuck Grassley's probably not going to have a vote that matters at the end of this, because the Republicans aren't going to play.
But are the end-of-life provisions going to be in this bill, or is this just the first thing that gets cut out?
No, they'll be in the bill, because this has nothing to do with death panels or any of that stuff. They're just making that up. And I think at the end of the day, you got to have a decent bill, and that's part of it.
Is this... I don't even know if there's a word that characterizes the last week and a half of death panel-itis and the paranoia that has managed to damage something that would benefit so many people who are there yelling about it as if it were a gunshot threat. I don't know what word describes that, but is it necessary to this process, or was the correct move in retrospect taking some input from the GOP at the beginning and then writing a good bill and telling them, vote for it or not, we're bringing it to a vote before this August dog and pony show can be conducted around the country?
I don't think the dog and pony show is all bad. First of all, people really are angry. They're not just angry about health care. In fact, they really, frankly, most of them don't know what's in the health care bill, because what they've been told is totally untrue. But they're angry because there's a recession going on. I would venture to guess that 90% of the people who are shaking their fists and shouting down congressmen didn't vote for Obama in the first place. There's a huge generational change going on in this country, and these are the folks that are very uncomfortable with it. So, look, this is not Obama's fault. He tried to get the GOP to cooperate. They're not interested in cooperating. Chuck Grassley bragged that he's sending the bill to the bottom, and he's one of the good guys, supposedly. So it's not going to work. We're going to have to pass this thing with a very big majority that the American people gave us, and this very vocal minority is going to have to custom itself to the change. And they will, because an awful lot of them are already on a government-run program. It's called Medicare, and they like it.
We kept hearing what a brawler the chief of staff would be, Rahm Emanuel, in that position, as he has been in so many others. Betsy McCoy dragged his brother into this, Dr. Emanuel, into this. So why is there not more dukes up quality to this from the White House? The press secretary was very cautious about what he said today about Senator Grassley.
I think these guys are digging themselves a deep hole, and they will encourage their base, and their base will get all exercise. But as I said before, their base is getting smaller and smaller and smaller. I think they're doing themselves enormous damage for their future, and frankly, the smart thing to do is step out of the way and let them keep doing this to themselves. Nobody really, truthfully, except for the most faithful of the far right, believe that there's a death panel in this bill. Nobody believes that, and the more they talk like this, the harder it's going to be to convince anybody that there's much substance to their proposals at all.
Shouldn't there be somebody out there handing out pieces of paper that have Sarah Palin's name on them, in which she declared a day devoted to exactly the thing that she's calling a death panel now, just a year and a half ago? Shouldn't that be the approach, though, at these town halls? Shouldn't there have been something more organized by the Democrats?
Well, I think people are, speaking up when they get a chance to get a word in edgewise at the town halls. I think that's great. But the truth is, let me just ask you frankly, do you think Sarah Palin has any chance of getting elected President of the United States? I don't. She could get the nomination, but she'll get 39% of the vote.
I would agree with you in terms of forecasting. I'm more worried about what somebody who has a certain cachet to them, whether it's positive or negative, can do to people who don't understand and who are scared.
Here's the danger. The danger is that they further divide the country, that they convince this 39% or whatever it is, that they really are being screwed and that the government's coming after them in every possible way. And that does lead to problems. I mean, there's no question that leads to problems. But at the end of the day, this is a short-term political tactic to try to embarrass Obama by beating his health care bill. I don't think it's going to work, and I think it's going to cost the Republicans a great deal by 2012.
All right, Governor, thank you. And if you could send me an email on that salary point that I could forward to my bosses, I'd appreciate it, and I'll give you a cut.
Thanks, Keith.
Howard Dean, great thanks.